morning. I hope that all of you are energetic as enough to listen to this lecture at this time. I'm Dr. Ehsan Hamifard, esthetician MD. I have more than 13 years experience in cosmetic dermatology. Today, I want to talk about acne scars combined treatment. So, why acne scars? Because there are many people that are involved from youth till middle age, and also this problem can cause low self-assurance in our society. And we as a physician, so it's very difficult to cure this problem. What is acne scars? Acne scars are usually the result of inflammable meshes caused by skin pores engorged with some excessive oil, dead skin cells, and bacteria. The pore swells, causing a break in the follicle wall. Shallow lesions are usually minor and heal quickly, but if there is a deep break in the wall of the pore, infected material can spill out into surrounding tissue and creating deeper lesion, and so the scars will be made. Let me talk for acne scars management. At first, I should say that acne scars are stubborn, and no signal treatment is the best for every one of our cases. We should use combined treatment to use all of the benefits of several methods to achieve the best results. But it's very necessary to emphasize that maybe some combined treatment can be with some side effects, and we should pay attention to which treatment we can prepare beside each other to achieve the best results. Here, I have listed for you the several methods that we can use for treatment of acne scars. For example, home skin care, soft tissue filler, collagen stimulator filler, a steroid injection, laser, other energy-based procedures, dermabrasion, chemical peel, skin needling, surgery, mesotherapy, and botulinum toxin. But at this lecture, I want to explain for you that which of these methods can help us to treat acne scars. And so I will explain you in my experience which of these are the best. So please accompany me at the end of this lecture. In my experience, the best combination therapy is using subcision with collagen stimulator filler injection, peeling with TCA, non-cross-link HA mesotherapy, and home use topical creams. I will explain you one by one of these subjects. At first, I want to explain that why these procedures are my selection. Because at this technique, we start the treatment of this scar at the two layer. First one, superficial epidermis with the peeling with TCA, and the second one, deep dermis with subcision and other procedures. The second reason for this technique is that these techniques have no side effects due to use non-cross-link HA mesotherapy and home use creams, that these methods can help us to protect the skin, the treated skin, and also increase the healing process of the skins. The third reason of this technique is low cost versus other techniques. And the fourth one, that is the most effective, because our treatment is from deep to superficial. It means that the full thickness of the skins are involved. At first, subcision with collagen stimulator filler injection. Subcision, what is subcision? During subcision, we release scars that have become stuck to deeper tissue and bound down. Collagen stimulator fillers have PLLA, and this is as a biostimulator and can rejuvenate and volumizing the skin. When we use these two methods with, simultaneously, actually we kill two birds with one stone. During this method, the bands of fibrous scar tissue become released, and simultaneously the collagen stimulator filler injected. So the deep dermis healing process starts with scar releasing, collagen stimulation, and volumizing. This is the video that shows how to use this subcision with collagen stimulator filler. I should explain that during this process, it's very important that we can inject this collagen stimulator filler very linear, and we should spread this filler under the whole of the skin, and we avoid from bolus injection. This is very important. The second method is peeling with TCA. TCA peel with a concentration of 15 to 20% can remove a uniform layer of skin cells from the epidermis. In the case of higher concentration, for example, 35 to 40%, the dermis layer is involved. So via this method, superficial healing process starts. With TCA, we can access to depths of ice-peak scars. This is very important. As you know, when one of our cases have acne scars, there are multiple scars with the different depths. And this is very important that we can access to depth of this deepest scars. And with TCA peels, we can access to this depth of scars and can help us to heal these scars completely. And also with peeling with TCA, we can improve the healing process of active acne. I means that if one of our cases have also active acne and acne scars simultaneously, this method can help him or her to remove simultaneously active acne and acne scars. This is the video that how we use peels at the acne scars. The third method is non-cross-link HA mesotherapy. With this process, we can improve the repair of peeled skin and also can help us to collagen stimulator process with the fibroblast activation and also hydration. And also, non-cross-link HA mesotherapy can help us to decrease the risk of peeling side effects, for example, erythema, dehydration, PIH, and hypersensitivity. And the last one is home use topical creams. This is depends on your diagnosis and on your cases. I prefer to use sunscreen to protect the peeled skin and decrease the risk of PIH, and also preparing cream to improve the skin healing process. But it depends on your diagnosis and on your cases and the material that you have used during these peels. Instruction. Now I want to explain you how can we combine these methods and use these methods beside each other. In my experience, this is the best that for first session, we use subcision with collagen stimulator filler because this process needs more time to do collagen stimulation and have some benefit effects on our healing process. So it is better to, at first, we use a subcision with collagen stimulator filler. And then during 6 months, we do peels every month. At first 2 sessions, we use TCA with 15 to 20% for all of the face surface. And other session, we use TCA with the concentration of 35 to 40% for only acne scars. In this period, we can use non-cross-link HA mesotherapy peeling between our peeling session. It depends on every cases, for example, 2 to 3 sessions. And as you know, that topical creams can help us to protect from treated skins. After 6 months, we can evaluate our cases and then decide for next 6 months period if she or he needed. Results. Since 3 years that I have been used this combined therapy for more than 300 cases, I have achieved wonderful results versus other techniques, for example, laser or other techniques. I have experienced that for acne scars treatment, we need combined therapy, and single therapy cannot satisfy our cases. During this therapy, we need our patient accompanied. So that is very important. We should explain the therapy process completely at first session. In my experience, this therapy period can be repeated for 2 to 3 times. This is some examples before and after 6 months. To make long story short, this method is the best method for acne scars treatment due to combined therapy and two-layer therapy. I means that when we use this method, because we start the healing process from the deep to superficial and full thickness of the skins are involved. So this technique can be the best one for treatment of the acne scars. And also, as you know, there are many cases that during single therapy, the healing process has been stopped. So the best solution is manage combined therapy. But the important point that I should emphasize, there are some side effects in non-experienced combined therapy. So this is very important that we use a kind of combined therapy that have experience and has good results during the times. Thank you for your attention. This is my social media characters, and I will be happy if you have a question, ask me. Thank you so much.